Thank you all for joining us today for this briefing on what the state is doing to slow the spread of coronavirus here in Nebraska. As always, we want to remind people that through the end of the month, we're still at the 10-person rule. And of course, we always want you to follow all of our good hygiene programs like washing your hands frequently. If you're going to go out in public, wearing a mask is a good idea. Stay 6 feet away from other people, all that sort of good stuff. On hospital data, we are still about where we have been. 46% of hospital beds are available across the state, 43% of ICU beds, and 77% of ventilators are available across the state. Testing schedule. So again, we want people to sign up for testnebraska.com. We've got about 150,000 people that are signed up for it right now. This will help us give an assessment of the state. It takes less than 5 minutes to fill out the assessment. Your data is secure, and this is how we're going to schedule people. And we are this week in Omaha, Lincoln, Hastings, Kearney, York, Seward, Beatrice, and Clay Center. I think we're in York this morning from 8 to 11, and then 3 to 6 p.m. this afternoon. So again, when I say schedule people, this is you sign up for the test. If you are one of those categories that's prioritized, first responders, healthcare workers, food processors, somebody who's 65 or older, somebody who's symptomatic, those are the folks that we look to prioritize to get the test. The testnebraska.com program schedules that, and it's free. So you don't have to pay anything for it to get that test. So please sign up for testnebraska.com as we get started here in this shortened week after the holiday. Actually, and speaking of the holiday, I want to compliment John Hilgert and his team, the Department of Veterans Affairs, for the virtual Memorial Day ceremony that they held here in the Rotunda. I thought it was very well done. They did a very nice job, and I want to thank all the volunteers who, stood there throughout the day to be able to really remember our fallen and for our veterans and all the men and women who put on that uniform. So thank you to all the volunteers who helped with that. Department of Motor Vehicles. So one of the things that we have done at the state is we've continued to work. There's been about 17 counties who have remained open throughout the pandemic. So we've continued to provide services through those counties and at their courthouses and so forth, their offices, to be able to provide driver's licenses. We've also worked with third-party providers on CDLs, those commercial driver's licenses, and we've been able to help about 700 people get those CDLs over the course of the pandemic as well. Our offices, our service centers are open too, so we continue to be able to serve people through that. And we want to continue to work with county offices to be able to provide those things. So Rhonda Lamb is going to come up and shoot. There was one other thing, Ron, I was going to mention with regard to DMV. What was it? Okay, she's looking at me like, I don't know what you're going to say. I'll think of it later, right? Again, I know. Well, Rhonda's going to talk about, I had signed an executive order 2025, which extends for some of our seniors their driver's licenses. So anybody who is 72 years or older will have their driver's license extended for 1 year as long as that driver's license expires this year. So if your driver's license expires this year, we've signed an executive order, or I signed that executive order that will extend it for a year. And what that is really about is making sure that our seniors don't have to wait in line, as we anticipate that there's some pent-up demand for people getting their driver's licenses. So we're going to just go ahead and waive those for our seniors so that they will not have to wait in line, and we'll be able to come back in 2021 to be able to get their driver's license. So with that, Rhonda, I'm going to go ahead and have you come up and talk a little bit more about what we're doing at the DMV, because every day is a great day at the DMV, right?
You got it right.
All right.
Good afternoon. Thank you, Governor Ricketts. I would like to thank the governor for the executive order he signed earlier today and for his ongoing leadership. This executive order will extend expiration dates for all driver's licenses for drivers age 72 and older whose license expires between March 1st and December 31st of this year, and it will extend them for 1 year past the expiration date on their license. This is a great step to help safeguard some of the vulnerable population from COVID in Nebraska. While DMV services continued to be available in all counties where the DMV was permitted to provide service, this meant we were only able to serve customers in some locations and only in 3 locations on a daily basis. Back in March, the governor signed an executive order extending the expiration date for all driver's licenses and ID cards until 30 days after the emergency declaration is lifted. This was great news for our customers who no longer had to rush to renew their license, but when the drive tests were suspended, It was disappointing for a few, especially some teenagers. Drive tests will commence tomorrow, Wednesday, May 27th. Services will be available in all counties where courthouses are open to walk-in public traffic. We will continue to operate our standard practices for drive tests in the Omaha Metro South office in Bellevue. To set up a drive test at the Bellevue Metro office, customers can give us a call to schedule their appointment. Details can be found on our website at dmv.nebraska.gov. We have taken a number of steps to increase our capacity throughout the state, including in the Omaha metro area. We are reassigning teammates, hiring temporary staff, and extending our operating hours in facilities where we are permitted to do so in order to increase our service capacity. We anticipate being able to more than double our standard capacity for administering skills tests in the Omaha metro area, and will ramp up further capacity as more temporary teammates come on board. Our teammates will be provided with appropriate personal protective equipment to help safeguard the health and safety of our customers and examiners. Given the confined quarters of the vehicle and consistent with recommendations from the CDC and OSHA, we will require our customers to wear a face covering while participating in the drive test. In line with the governor's message, we are asking anyone who is unwell to please stay home, and we'll be happy to reschedule your drive test for a different day. I know many people are wondering when their local office will reopen, and I will tell you you'll need to contact your local county officials. As soon as the county lets us know the date they intend to reopen, we will publish the date driver's licensing services will be available on our website. As counties choose to open their offices again to walk-in public traffic and allow us to provide driver licensing services in their building, we will resume services in these areas. Lastly, I would like to remind everyone of the services available on our website at dmv.nebraska.gov. Time and again, Nebraskans have chosen to help out their neighbors and community when they can. Because services were no longer available in most counties, we asked Nebraskans to go online when possible, and they did. We have seen a big increase in our traffic to our website. We are very grateful for them using the alternative service options available, as it helps us serve customers where services may not be available. The vast majority of our customers are able to renew their driver's license or state ID online, and it is by far the easiest and fastest way to renew their license. We look forward to being able to resume full services across the state as quickly as possible.
Thank you very much, Rhonda. And just so we're clear, again, when we're talking about skills test, that's a driving test.
Right.
And so in the past, you've always had to schedule, make an appointment with that. And starting today, you've opened that up to start getting appointments. Is that correct?
So, correct. We're taking appointments as we
Right.
speak for Omaha.
Taking appointments as we speak for Omaha,
It's walk-in everywhere else in the state, and that's where it's always been everywhere else.
and it's walk-in everywhere else in the state. And that's the way it's always been everywhere else in the state. So,
We did appointments in Omaha.
yeah, so it's just kind of standard practice, right? In Omaha, you have to make an appointment. The rest of the state, where we still have county offices open, those 17 or whatever, then you will be able to walk in and get your driver's test. So good news for those teenagers who haven't got their driver's license yet. All right. Thank you very much, Ron. Appreciate it. All right. So one of the things, we had the First Lady in here talking about what Nebraska Impact is doing to provide masks to people in vulnerable communities. Their goal was to get 2,500 hand-sewn or cloth-covered masks to be able to distribute. So they asked for people to sign up to be able to provide those. And very pleased to let people know we're about halfway there. We got about 1,200 of those masks. So if you would like to drop those masks off, you can, or send them, those masks in, you can still do that. We still have room to take more. So you can mail them to 201 North 8th Street, Suite 215, here in Lincoln, 68508. So again, if you've got masks you're ready to send in for Nebraska Impact to distribute, 201 North 8th Street, Suite 215 in Lincoln, 68508. So go ahead and send those in. You can, if you want to drop them off in person, you can send an email to masks@neimpact.org. So masks, MASKS, at NEIMPACT.org. You can email in. And then, of course, if you are still, if you're interested in getting a pattern or sewing or whatever, you can go to the website, www.neimpact.org/masks, and then there's where you can find out more information about the program there too, and including patterns to be able to sew. I believe you can find those patterns there. So again, please help us out. We're about halfway there. So anybody who's interested in sewing those masks to be distributed, please look at the Nebraska.any.org website or send an email to mass@anyimpact.org. Also in that good news category, Medica, who is one of our insurance providers here in the state of Nebraska, is going to be putting about $15 million of the reserves into banks, community banks, here in the state of Nebraska. So that is in conjunction working with the Nebraska Independent Banking Association, and it will go to about 60 of our community banks here in the state. And as you know, when people deposit money in banks, that money then gets turned around into being able to do things like loans and so forth that help grow the economy. So we appreciate Medica being a good business partner here in the state, with the state of Nebraska, and depositing some of the reserves here in our state that then can be used in this community to be able to continue to grow our great state. So thank you very much, Medica. We appreciate it. Schedule for the week. So again, English language briefings here, 2 o'clock Central Time, Tuesday through Friday. We will have Spanish language briefings at 5 p.m. today and on Thursday again. I will do my last town hall on NET rather, on Thursday night from 8:30 to 9:30. Commissioner Bloomstead is going to be joining us, as well as Dr. Ali Khan from UNMC, so should have a good lineup there to be able to talk. And I think that covers it for our announcements. I've got a question here, and I think we might have a couple more, but Delon Diller from KETV. When will the governor lift the moratorium on evictions and utility shutoffs? What is the governor doing to assist Nebraskans who are financially impacted by coronavirus and could face eviction or utility shutoff when the moratorium is lifted? So take a step back on the utility shutoff. That's actually the local utilities are handling that individually. So the executive order assigned did not impact utility shutoff. So my understanding is the utilities are all working locally with regard to that to make sure people's who have not been able to pay their utilities aren't getting shut off. With regard to eviction notices, there's an executive order that waives a statute that requires those evictions be scheduled within 2 weeks. That's expiring at the end of May, and I announced last week that we're going to continue to let that expire. However, what we've seen is with the money going out for the unemployment insurance, the pandemic unemployment insurance, that's $600 a week. That has started flowing out to people. We've got programs out there already through the federal government that has distributed over $10 million for homeless shelters and housing assistance to be able to help with that. Also, your community collaboratives do this all year round. So community collaboratives work with people to be able to help them if they're having difficulty with their rent. So I'd also suggest contacting your community collaborative with regard to that. So several options out there for folks. Oh, and of course, all the stimulus check money, the $1,200 went out to just about all those taxpayers as well. So lots of resources out there with regard to evictions. And Taylor.
Yes.
Yeah, where are you? Okay, there we go.
Don Walton would like to know what are the latest hospital figures for the Omaha area?
So Don Walton would like to know what are the latest hospital figures for the Omaha area. And Dr. Antone, I'm going to call you up and have you give those to us, please.
So in the Omaha, Douglas County area, hospital situation has been very stable this past week and over the weekend. We currently have 135 patients hospitalized in the Omaha, Douglas County area. And compared to a week ago, that is an increase of 13 COVID-positive patients. We were at 122 a week ago. So we have seen an increase in the number of patients hospitalized, but it hasn't really affected the bed availability generally or the actual ICU bed availability. We are at a 29% bed availability. We have 473 beds, or excuse me, 477 beds, or 473 beds out of a total of 1,647 beds available in the Douglas County Hospital area. That's 29% of bed availability compared to a week ago. That's an increase of 1% of bed availability, even though we did see an increase in the COVID patients being hospitalized. For ICU beds, there's 89 ICU beds available out of a total of 365. For 24% ICU bed availability, that's an increase of 3% from last week. Ventilators don't seem to be an issue in the Omaha, Douglas County area. We have currently 188 out of 319 ventilators available, 59% ventilator availability in the Douglas County area. So I'm in contact again, even over the last 3 days, even more close contact with all the CMOs of the major hospitals in the Omaha area. Everybody feels like they're being able to handle the situation. We don't know really what percentage of bed availability is the right number right now. We're working on that to see. They feel they're managing the situation with the numbers I just gave you without any issues. As a matter of fact, after this conference, I'll be going down to meet with the pulmonary critical care doctors of each one of the major health systems to get their feel on how the ICUs are doing. Right now, it appears to be more of an ICU availability issue than a general bed or ventilator issue. So we're working very closely with them to come to that right balance as far as how we manage the COVID situation. Again, just to give you an idea, over the last 7 days, the number of hospitalized patients has been right at that 130 to 135 over the last several days. So really not a large increase or decrease. Anything else?
Thank you, Dr. Anto.
Don also wanted to know, are you aware of any weekend activity in Nebraska that violated directed health measures, and how should such violations be handled?
So the question was, am I aware of any weekend activity that it violated directed health measures here in the state of Nebraska? And if so, or in general, how should those measures be handled? I am not aware of any incidences where we had directed health measures being violated. And consistently, what I've said to folks is if you see somebody who could do a better job, contact that person first. Find the owner, the manager, whatever venue that is, and talk to them about it first. If you think that you need to have somebody else or it's a little bit awkward for you to do it, contact your local mayor. That's always a great place to start. Have the mayor reach out to that person. I always hold up the example of Mayor Gene Stother in Omaha. You know, weeks ago when we were getting started on this pandemic, we had issues with the big box stores, and she reached out to them to ask them to take additional steps to be able to do social distancing, and they did. And that's what really our experience has been, is every time you've reached out to somebody and talked to them, almost universally, people are willing to accommodate you. So my first reaction, and would share with everybody, is if you see something that you think somebody could do a better job, just open up that line of communication in a very polite way, ask them if they can do more around social distancing or whatever you think needs to be improved upon. So that's how I would encourage people going forward, if they see something, to be able to handle it.
Christina with NET says, you talked about how meatpacking outbreaks could be due in part to dense housing among workers and their families. Do you feel like pointing this out builds stigma against hard-hit communities? What is your take on that?
So Christine, NET is saying, hey, I pointed out that part of the issue could be dense living, accommodations for folks in our food processing communities. She's saying, could that stigmatize them, and what is my take on that? Actually, I don't think that is something that is unique to the food processing industry. I think there's a number of people who live in housing that could be difficult to socially distance. And so that's why we have created a whole program around being able to do that with regard to what we're doing with UNO, UNL, and so forth, is if people feel like they have to move out to be able to make sure that they're protecting their loved ones, we have space available to do that isolation, that quarantine. And it may not just be around dense housing either. It could just be you've got an elderly person at home. So if you've got multiple generations and you've got somebody elderly at home you don't want to put at risk, we've got housing accommodations to be able to help out that, and you can get access to that through your local public health department. So I don't think it actually is related specifically to food processing.
Danielle wants an update on how are we going to reach our goal to get to 3,000 tests per day through Test Nebraska?
So Danielle wants to know, what are we doing to get to 3,000 tests per day through Test Nebraska? Actually, folks, I got to tell you, we did give most of the folks that were doing the testing Sunday and Monday off so that they could rest up and spend time with their families. But starting today, we're getting right back at it with regard to getting that ramped up with regard to Test Nebraska, and I'm continuing to push the team to get up to that 3,000 tests a day.
Michelle of KTV says that there are family members at the Life Care Center who feel like are concerned about people that are testing negative being returned to the facility. They prefer that the facility be shut down and people move into a hospital. What do you think about that?
So Michelle Bender at KETV says that there are family members who are concerned about their loved ones who are testing negative and being asked to return to the Life Care Center, and they would prefer to have that facility shut down. So we work with Douglas County Public Health Department, we work with UNMC, and their experts, you know, the ICAP program I think I've described here in the past, to really come up with what those best practices are. We work around staffing, and staffing is a big part of it to make sure that they have the staffing available to be able to provide the appropriate level of care there. And as we talk about these considerations, we think the most beneficial thing for folks is to be able to be taken care of in surroundings that are familiar to them by people that are familiar with them. Now, obviously, if they can't do that, if the staffing is not available, we'll make other accommodations. Obviously, if you need acute care, then the person goes to the hospital. So that is the approach we've taken on this. But I might note that family members always have the option of being able to take their loved one home and on a short-term basis be able to care for them at home as well. They don't have to leave them in the facilities. The family members can take those folks home too. And I know that's happened as well.
Sydney Holzfaster wants to know if you plan to extend the eviction moratorium for people on rent.
So Cindy Holzfaster wants to know if I am planning on extending the eviction moratorium, and we covered that in an earlier question. We're not. That order will expire at the end of the month.
Melanie Wilkinson from the York News Times says if someone has a wedding in their private property in June utilizing a large building, how do they determine the capacity limit if they don't already have a rated capacity?
So Melanie Wilkinson of the York News Times wants to know that, hey, say I'm having a wedding at home and I don't have a rated occupancy, how many people can I have? That then falls under the 25-person rule. So if you're having that, if it's not a venue where you've got a rated occupancy, then you will be under the 25-person rule in June for gatherings.
That's all I've got for now.
All right. Other questions from inside? Yeah.
More DMV questions.
More DMV questions. Should we call Rhonda up here for those? Rhonda, please come up here for DMV questions.
I'm just wondering, was every service that the DMV provides able to continue in some capacity even at the closed locations, except the driving test?
So in our offices that we have control over in the Omaha metro area, all services were provided with the exception of skills testing, the drive test for passenger vehicles and commercial vehicles, although most of the commercial vehicle testing is done by third-party agents anyway. So in the other offices that we were in, we provided all services as well, except skills testing. But in the counties where they closed the doors, we weren't permitted to provide any services at all.
Will there be a big backlog of people needing services once they do start to reopen?
Well, there's no, I'm sorry, I should repeat. Do I need to repeat the question?
Yes,
If they're in- So the question is, will there be a backlog of services once the offices begin to reopen? While we don't have any way of knowing that number exact, I think you can anticipate that if some services weren't provided in a majority of the counties for 2.5 months, there's going to be some backlog of services. That's one of the reasons why we have purposefully reassigned people, hired temporary workers, and made available over 50% more skills testing slots available in anticipation we'll have some of that backlog.
Go ahead, Fred.
Isn't one of the purposes of making people renew their driver's licenses to check up on whether they still retain the skills necessary? And wouldn't that be especially true for older drivers? And how did that factor into your weighing of the decision to extend the 72 and older licenses by a year?
So the question isn't part of renewing the license and checking their skills or eye test or whatever a factor in the renewing, and did that go into the consideration for the decision to extend 72 and older? Well, first of all, there's another mechanism that's in play always if somebody feels the driver's unsafe, and they have the ability to submit a form to us we call a recall notice, where at any time we can call people in and ask them to do a written test, a drive test, and have a doctor verify that they're physically able to do the test. So the piece that happens in our office is they do an eye test that tests only distance vision at the DMV. So we still have a mechanism in place that if somebody feels that somebody's not a safe driver, that we could still address that. So at this time, I don't have concerns that will cause us any safety issues.
I was at the Lincoln DMV today just getting some video, and there were a ton of people driving up to the windows to see if they were open and wanting services. Can you talk about
So I mean, I don't, the question is, they were at the Lincoln office and they saw people driving, presumably wanting services. Can we address how that's impacting it? I don't know we have been in conversations with Lancaster County trying to ascertain what date they plan to reopen their facilities so that we can start providing services there.
So Rhonda, just so we're clear, Lancaster County is closed, is that correct?
That is correct. Lancaster County is closed. And so we have let them know that we are ready, willing, and wanting to start providing services in their county and to the customers that we serve there and to the residents who live here. But until they open their doors, we can't provide services. People who do need to just renew their license can do that online. But it's the services that require testing that have to be done in person that will need to come to the office.
Who makes the decision that offices in Lancaster County open?
That's made by the local. Oh, I'm sorry. The question is, who makes the decision about opening the offices at the local level or in Lancaster County? Those decisions are made by the local governing board. And so in some counties, the county board, maybe in some counties, the individual office has the autonomy. That varies from county to county, but those are local decisions made by the local officials about when those offices open.
And then in reference to your closure up in Omaha for your department, do you have an idea of a 3-month span, how many people would have given the closure would have taken the test and that you could expect? Not specifically, you can't predict how many people would have come in, but like 3 months, say January, February, March, or something along those lines?
So the question is, can we predict the amount of people that would have come in to take tests during the time that was closed? So we did look at the data from last year and compared last year to this year, and what the average number of drive tests in the Omaha metro area was about 50 per day. We now have the capability to increase more. We're increasing not only what we would normally see here in June, July, and August, but we are increasing that plus the 50 plus more capacity. So we anticipate that we'll be able to catch up on our backlog within a very reasonable amount of time.
Other questions for Rhonda? All right, thank you, Rhonda. You got a lot of questions there, Rhonda, just so you know. You've been very popular. Yes?
I've seen a lot of talk online, people asking if they should have garage sales or yard sales right now, and if we're heading into that season, what would your advice to them be?
So the question is, what would be my advice for people who want to do garage sales or yard sales or something like that? Again, if you look at what we put out there for starting June 1st with regard to a 25-person rule, as long as you're following those sort of guidelines and doing social distancing, finding ways to make sure people don't bunch up, if you've got a checkout line, keeping people 6 feet apart in that checkout line, wearing a mask yourself if you're going to have a yard sale, maybe having masks available for other people to use, because that's going to be best practice for people to use masks when they come in to a yard sale. If you think about just running it maybe like a retail operation, which are up and running, and just take it from that kind of standpoint, you would be able to work on having that garage sale at that 25-person limit. Martha?
Governor, State Senator Mike Moser has been hospitalized because he has the coronavirus. And do you have any thoughts about this development?
Well, so the question was, State Senator Mike Moser has been developed coronavirus and is hospitalized for it. And so first of all, I've been praying for him and for his family, as he goes through the recovery process. So we hope his recovery is quick and full with regard to that. And, with regard to other thoughts, we just hope that, again, people will continue when they're out in public to practice good social distancing so we can limit the spread of that virus. With regard to speakers here, that's really his body to manage and determine how he is going to be able to work with his members when they come back July 20th.
So can you confirm that he has been hospitalized?
I read in the paper today that he was hospitalized. Oh, so the question is, can I confirm he's been hospitalized? I read in the paper today he was hospitalized, so I presume that's right. So I read it like you did. Yeah, John.
In regards to the Douglas County Hospital data, how much more would it need to go up in order for you to maybe put back some restrictions in Douglas County that are going away?
So the question was, with regard to Douglas County Hospital data, what would have to happen for us to maybe putting some more tighter restrictions in place. And actually, right now, what we're doing is, as Dr. Antone said, he is working with the chief medical officers of the hospital systems in Omaha to talk to them about how they're managing the current hospital census, what is the appropriate way to be able to manage this and so forth. So those conversations are ongoing right now. So I don't have any guidance to give you with regard to that because we're still having those conversations.
Is there a concern that the ICU bed availability is slowly but steadily going down?
So there's their concern that the ICU bed capability is steadily going down. And actually, as Dr. Antone indicated, it's actually gone up over the course of this last week. Now, it's only gone up 1%, but that would seem to indicate, at least in the short term, it's been relatively stable. So again, this is why we're continuing to have the conversations with the hospital systems there to find out what is that right level. Martha.
Along those lines, you have always talked about the need to not overwhelm the hospital, the healthcare systems and the hospitals, and we're seeing, their capacity slowly dwindling. Does that raise concerns for you?
So the question was, I've talked about making sure that we don't overwhelm the hospital system and the capacity, and we see that margin shrinking, and does that concern me? And that's part of why we're having the conversations here with the hospital systems in Omaha, specifically around their capacity and being able to handle additional coronavirus patients. One of the things we've seen, as Dr. Antone indicated, over the last 6 days or so, the number of patients hospitalized for coronavirus has stayed at about 135 for the last 5 or 6 days. And the number of patients on ventilators has been around 42, 41 for the last 5 or 6 days too. So that's been actually pretty stable as well. Or I'm sorry, that 42, 41 is the number of patients in ICU, COVID patients in ICU. So part of the other dynamic that's going on here is our working theory is that, and this is what the hospital people tell us, is that other people with non-coronavirus related issues have put off going to the hospital, and now they can't put it off any longer, so they're coming into the hospital system. So obviously, we don't want to deny access or care for those folks. These are not elective surgeries. These are people who maybe have a cardiac issue. They put off going to the hospital, now they need to go to the hospital. So that's why we're having those conversations with them to make sure we manage this in the right way. Lee.
You might have Dr. Antone to give the Lancaster County data update as well.
Dr. Antone, will you come up and give the Lancaster County data?
So in the Lincoln-Lancaster area, again, very, very stable. There is 188 out of 378 general beds available. That's a 50% bed availability. And they've been running right around 35 to 40 patients in the hospital over the last week or so in Lincoln-Lancaster. The ICU bed situation is 82 beds available out of a total of 138 for a 59% bed availability. And ventilators, again, are very, very non-issue. 194 out of 230 ventilators available. Only 12 patients with COVID-positive diagnosis on ventilators in Lincoln-Lancaster. And again, in talking with the CMOs in Omaha and knowing that St. Elizabeth's, the CHI hospital, they've all agreed to cooperate again to even use Lincoln's capacity if that's necessary, especially, even between systems, whether it be CHI or Bryan or University of Nebraska. As a matter of fact, that happened this weekend where Methodist Hospital did receive some patients that were initially slated to go to UNMC, but because of their capacity at Methodist, they were able to help with those patients getting to their facility. So we're seeing, again, great cooperation within and between systems as far as handling the situation. Just like we saw in Grand Island and Lexington, where the local hospitals around those areas pitched in to help out.
I was also curious, in regards to the bed availability, are you able to name the hospitals that you include in terms of the total cumulative bed data to know that which major hospitals in these areas they are?
I do know that there are certain hospitals that are a little bit busier than others, like, say, for instance, University of Nebraska.
He wants to know which hospitals are part of the data. It's all the hospitals.
Oh, it's every hospital in Douglas County, but mostly the main three systems, UNMC, CHI, and Methodist Health System.
Are there hospitals included in that total bed count data that aren't equipped to handle COVID patients and to the degree
every one of those health systems can provide great care for COVID patients right now in Lincoln and Douglas County, Lincoln, Lancaster, and Douglas County. They've been doing so since the beginning. So, and I wouldn't differentiate between any one of the three, to be honest with you. I think they all provide excellent care. Martha?
I know that there's, the market for hiring people in healthcare has been tight for some time. Are there enough staff available to provide the care needed to, if as the number of patients, especially in ICUs?
So Martha asked a question about whether, not just having the physical space or the bed availability there for taking care of patients, but also the staffing necessary. And they are assuring me now that they have the staff. They've been gearing up for this. They call it staffing up, where I'll even give the personal example, like my son, who's a OR nurse but used to work in a step-down unit. He's been staffed up, trained to go ahead and take care of an ICU patient now, should that be necessary.
Dr. Antone, in the data you provided, those are staffed hospital beds.
Yeah, those are staffed beds. Those are beds that are staffed, which means they have the staff available to take care of those patients. There's other means that they can do that. I think I mentioned before last week that sometimes an ICU patient might just be in charge or taking care of one or two patients at a time. And now they might be asked to take care of 3 patients at a time, but they will be getting other help to help with other things that aren't really skilled for nursing, such as running IVs and drips, but getting help to turn patients, to bathe patients, help with things that nurses really aren't required necessary to do. And so they bring in those staff. And so there's plenty of help from that standpoint. And then lastly, like especially in the ICU situation, all certified registered nurse anesthetists have worked in an ICU at one point or another. That was a qualification for getting into certified or registered nursing anesthetist school, is that you had to have ICU training before that. And they can go back and staff the ICUs too. So those are all means how we get the staff.
Thank you, Dr. Antone. Yeah.
A question for one of my coworkers. The Lancaster County Event Center plans to have high school rodeo finals this July, and to host thousands of people even with a limited capacity. And apparently, some people come all the way from Canada and Australia to compete. Should there be any limit on if those international competitors can come, or any different rules for those competitors?
So the question was, Lancaster County Event Center is planning on hosting the National Finals High School Rodeo, and people come from all over the country at the end of July, but also come from international destinations like Australia and Canada and Mexico and so forth. Our current DHM calls for international travelers in June to quarantine for 2 weeks. Will there be additional steps in July? And I would say we'll probably just have to kind of stay tuned and see how things are going at that point with regard to what we're seeing here in Lancaster County, and then also what is going on in those other countries where there are people, coming from as well. So we'll have to see how this all plays out through the next few weeks and then make a decision with regard to what will happen specifically for that event. Other questions? Martha.
There was a question about how we're doing on the 3,000 per day goal. So how many tests have we gotten up to?
So the question was, with regard to 3,000 tests per day goal, how many tests have we gotten up to? Dr. Antone, do you have that up at the top of your head? He's looking for right now. One thing I will say, though, over this weekend, and I meant to mention this when we were talking about testing data, we have done, over the weekend, we crossed the line where we have done twice as many tests, and this is not just Test Nebraska, this is all testing. We've done twice as many tests in May as we did in March and April combined. So testing capacity in the state of Nebraska has really ramped up. We'll probably have to get back to you, Martha, with regard to that current testing data list. Dr. Antone, you got it? Okay, we'll get back to you on that one, Martha. I don't have it off the top of my head. But obviously, one of the things, as I said, we're pushing the team to get ramped up to that 3,000 tests a day.
Governor, sometimes
Well, we want to increase the number of tests overall to basically be able to increase the amount of data that we have statewide. So ultimately, where we're going with this is that when you are managing a virus like this, which we will be doing for the foreseeable future, as I said in the past, right, until there's a vaccine, we will want to make sure that if there is somebody who gets that case of coronavirus, that we are discovering that person as quickly as possible, getting that person to isolate, going back through their contacts to make sure that all those people know that they've been exposed and determine the level of exposure. Some of those people may need to quarantine. But this is standard epidemiology, right, on how you handle a pandemic is you find the people who are infected and you take them out of circulation, so to speak, with regard to the rest of society so that you can make sure they're not spreading it to the rest of the folks. So by increasing testing, we will have a better chance to catch those people who are out in the community that may be walking around with coronavirus and spreading it. That's why we want to increase the amount of testing.
Well, that makes sense, but why wouldn't that also then be true within a prison?
So with regard to corrections, inmates, they're getting treated like everybody else who presents symptomatically, but they're an isolated population, right? So we want to continue to, again, one of the things we do, if you're a corrections officer, you're prioritized in Test Nebraska to get tested, right? So if you want to get tested and corrections officer, sign up for that. So we do prioritize those, but those are the only folks who are going out in the public, right? The inmates aren't going out in the public. So by and large, I mean, we do have the community corrections and so forth, but by and large, the inmates are not going anywhere. So we treat them just like the rest of the regular public, that if they present with symptoms and we think that's likely they've got it, then we will test them. Yeah.
I've been filling out the Test Nebraska surveys, and nowhere on it that I can recall it asks about your occupation.
When you fill it out for the first time, it does have a line for what your occupation is on there. I'm sorry, the question was, I filled it out, didn't see the occupation. So yes, there is a way to go back in. So if you just go back to testnebraska.com, fill out the survey all over again, you'll see that one of the questions is, what is your occupation?
We have time for a couple more questions.
A couple more questions. All right, seeing none, I'll go ahead and wrap it up for today. But again, thank you all very much, folks, for joining us here this afternoon. We'll be back here tomorrow afternoon at 2 p.m. Central Time to be able to talk about what the state is doing to slow the spread of coronavirus. I want to thank all the Nebraskans who have been working very, very hard, making sacrifices to slow the spread of virus here in our state. It has worked. Thank you so much. We need your continued patience as we go through this pandemic, and we will continue to work with you to make sure that we're doing everything we can to slow the spread of the virus and allow you all to return to a more normal life as we all find that new normal with regard to this virus. We'll all get through this together. Thank you all very much again, and we'll see you back here tomorrow.